This is the Thom Hartmann Program.
Welcome back. Thom Hartmann here with you. And on the line with me is Julio Rivera, Editorial Director at the Reactionary Times, columnist with Newsmax, right-wing news and politics. Reactionarytimes.com is the website. You can tweet Julio at, oh, yeah, it's Julio. And Julio, welcome back to the program.
Hey, how are you, Tom?
I'm well. I'm not sure America is, though. We've got Gabriel Winnock wrote this piece for the New York Times about the horrors of elder care. California, Connecticut, Illinois, Kansas, Michigan, Minnesota, New Jersey, New York, Ohio, Pennsylvania, Texas, and Wisconsin, all having major scandals about people being treated so badly in these warehouses for elderly people. That was largely done away with by the expansion, by an expansion in the early 1980s, actually, under Reagan, of Medicaid. And so we got that. Then we got this piece Molly Redden in New York writing in the Guardian. GOP health care bill may send pregnant women back to days without coverage. It starts out in 2011. This woman who was, getting married and planning on having a baby, and she found that she couldn't get any health insurance anywhere in the state of Missouri that covered pregnancy without an 18-month waiting period and an additional $100 to $1,000 a month additional payment. And that was done away with by in theory, it was done away with by the Pregnancy Discrimination Act of '78. But in 2014, health care plans were sold to individuals that didn't require maternity coverage. And then finally, in the New York Times here, 2 cases of the plague in New Mexico. I mean, wouldn't you think that public health, everybody having access to health, would be a public health issue? Would be a national security issue.
No, I understand what direction it is that you're taking it, but I think that there's and listen, first of all, I want to preface this by saying I am not in favor of this current GOP healthcare bill. I have my own reasons why I don't like it, which are probably different than yours, but I just want to preface it by saying that. But the demagoguing of the Medicaid situation is in full force right now. I mean, it's not a cut necessarily. It's a cut in the rate of growth. It's what Barack Obama or somebody like him might like to call a sequester, where you're slowing the rate of growth, but you're not exactly cutting anything.
But you're not slowing the rate of growth of baby boomers aging into
to 436 billion over a 10-year period. So it is still growing.
Julio, you're not slowing the rate of growth of the biggest bulge generation, arguably in American history. Maybe there was a similar one after the Civil War. Of people now aging out. You've got baby boomers who are hitting their 70s right now and going into nursing homes.
Yeah, but they're going to be getting Medicare, not Medicaid. The majority.
Medicaid is what pays for nursing homes, not Medicare. Medicare will not pay for nursing homes.
I understand, but they're not the only people that are on Medicaid. There's going to be There's going to be more money. In fact, it grows. If you
64% of all nursing home enrollments right now are paid for by Medicaid.
Okay, I understand that, and they're still getting a 10% bump in spending over a 10-year period.
But they're getting like a 60 or 70% increase in people. I mean, it's like what you're saying to me is don't worry, this car will drive all the way to California. We've got 10 gallons of gas.
To that generation. No, that's absolutely a false number. That's not correct. But the other part of it, too, is that the states are going to decide the way that Medicaid is going to work and what their participation levels are going to be at and all of that.
Yeah, like Mississippi has a lot of room to raise their income taxes to pay for more programs. Come on, all the red states are taker states, Julio. Every single one of them is, for every dollar they get, they send to the federal government, they're getting $2 back.
The biggest taker state that there is California. I mean, Jesus Christ.
California, for every dollar California sends to Washington, D.C., they get back about 75 cents. California is a maker state, as are all the blue states. The red states are the taker states, and they're the ones who are going to get hit the worst by this because they're the ones who are desperate, for federal funds.
No, they're not. Most of those states have budgets that are either balanced or their debt is nowhere near at the level of a state like California.
Because of federal funds. Because of federal money. Because they're for every dollar they send to Washington, D.C., they're getting more than $1 back. Look it up. I'm not making this stuff up, Julio. This is not rocket
Listen,
science.
I'll tell you this much though, because since I'm a conservative and a Republican, and the perception is that we're all greedy, terrible people. The bottom line is this is America, and America is by proportion with the rest of the world a well-to-do country in some ways, not in every way. We obviously have to be able to take care of people. The big concern here, and I think what's lost, is that people always make the emotional argument for for the people that are completely out of it, like the very, very, very
Well, if you're
poor.
talking about
We
your
can't
father or mother
always
being
make
in a
the
rest
argument
home,
for them.
how
We
is
have
that
to
not
make the argument
emotional?
for the people that do work, the people that they comprise the majority mainstream America, those Americans, they just want to have access to affordable health insurance. And the reason that they haven't is because of the heavy-handed, regulatory burdens.
No, the reason they haven't is because
put
there's
on by
banksters between us and our
Obamacare,
doctors.
and now by the American Health Care Act. What they need to do is they need to ease that so that we can have those, the interstate sale of insurance. We need things like tort reform. We need expanded and fully tax deductible healthcare savings accounts, things like that. And then the other pieces will fall into place as, more people enter.
Julio, this is nonsense. Texas passed tort reform 10 years ago. They said you can't sue for more than $250,000. That's the maximum that your life is worth. It didn't do anything.
Provider is actual, malpractice insurance. If you reform that, it will obviously bring down the cost.
No, they did it in Texas. It didn't do anything for the rates. All it did was screw people who were badly screwed by their doctors.
No, that's a good soundbite, Tom. But
look it up, Julio. Texas has had tort reform for a decade. It's not reduced. I'm
not saying that that's the be-all, end-all, Tom, and that's going to fix the problem.
Well, and health savings accounts aren't going to do anything for anybody who's not wealthy enough to put the money away.
What was that?
Health savings accounts aren't going to do anything for anybody. What's $5,000 in them? First of all, how many people have an extra $5,000 every year to toss into a health savings account? Number one. And number two, when you get cancer and you're looking at a $300,000 bill, how's that health savings account going to help you?
And how about making fully portable ones that families can all contribute into? So if you have a family of 5, 6 people and everybody's paying into it, whoever needs it.
Well, that works great if you're a rich Republican. But
making those healthcare savings accounts fully portable between family members.
So that works marvelous if you're somebody with a $400,000 a year income.
Putting money into it.
Or if you're a billionaire, I get it, but I don't see where that is of value to somebody making $50,000 a year.
The average American family over a 2 to 3 year period can put away, somewhere between $5,000 and $12,000. If there's 4 or 5 working people contributing into it, and then God forbid if somebody needs to use it, they have some semblance of a cushion there. I mean, it's not perfect. This is the problem with people assume the government can come in and make one big sweeping change to something as big as,
like Canada did, like France did, like Germany did, like Sweden did, like Norway did, like Denmark did.
No, that doesn't work.
There are 35 developed countries in the world, Julio. The Organization of Economic Cooperation and Development, the OECD countries, there's 36 developed countries in the world. 35 of them have single-payer healthcare programs.
Yeah, I don't want to live in a country where my tax rate is 80% and the suicide rate is high. I don't want to be sitting there in that type of an environment. Americans want to be free. We desire to be free. We desire low taxes, and we desire choices.
So your definition of freedom is not having health insurance. Your definition of freedom is not having health insurance.
No, not having the freedom to purchase the health insurance that you want and not be forced to put on the hook to pay for services like some guy in jail sex change or anything like an abortion that would violate your religious liberty.
But you have no problem paying taxes for, wars that you don't agree with?
No, I don't like war. Listen, first of all, we want to go with the war issue. I believe in peace through strength, but I didn't believe in the Iraq war, if that's the way you want to take it.
I just think the whole...
I'm not a neocon nation builder. I believe that we should keep our country
We either do it for everybody or we don't, Julio. I mean, are we a we the people nation? The first 3 words of the Constitution, the first 3 words of the Declaration of Independence, we the people. Are we a nation of, by, and for we the people, to paraphrase Lincoln? Or are we a nation of, by, and for rich people who can afford health savings accounts?
Listen, we should be a country that provides the maximum amount of choice and opportunity for American
And why
citizens.
don't we do what Canada did?
But unfortunately, listen, this system has gotten too big, and it's gotten too big because of the progressives in government, that they want to sit there and stick their hand.
It's gotten too big because you got a bunch of health insurance CEOs who are ripping us off.
Listen, that's what weakens we the people more than anything else, is these tax and spend progressive policies that your party mostly backs.
Yeah, so you're promoting the freedom to pay 20 grand a month if you have a pre-existing condition. Do I have that right?
Well, listen, if you can't expect an insurance company to just automatically take a hit like that, and you can't.
That's why we shouldn't have insurance companies.
Wait a minute, and I want to make a point too about for-profit health insurance. If you don't have, and listen, there's banksters and profiteering and all those things that you talk about in the health insurance industry. I'm right there with you, Tom. Like literally, I'm sitting shotgun in the car next to you on that one. But the fact is, if you don't have for-profit healthcare, the level of service goes down. You no longer get the best and the brightest.
We're 29th in the world,
and the
Julio.
overall level of healthcare goes down.
We're 29th in the world in healthcare outcomes.
Get crappy healthcare, and they come here for healthcare.
We're 29th in the world in healthcare outcomes. We are the most. We spend in the United States spends $8,233 per person on healthcare. Norway, the next most expensive country in the world, spends $5,300. Switzerland spends $5,200. The UK spends $3,400. All of those countries have better outcomes than we do.
I don't know. I'd still rather see a doctor in America than any other country.
Because you can make money, right?
No, not because I have nothing to do with making money off of the healthcare industry.
Then why would you rather be a doctor in the United States? My doctor is insanely frustrated by the insurance. She's got to hire 2 people for a 1-doctor practice just to deal with all the paperwork. Whereas in a single-payer system, she can do it herself.
You know what? And that sucks. And I totally agree. There is way too much bureaucracy.
So let's go to a single-payer system. Let's do like Norway does and get our costs from $8,000 a person down to $5,000 a person. Save the country $800 billion a year.
That for every single person. We have over 300 million people in this country. We would not be able to service that many people.
Oh, it would be easier for us, actually. There are 800 million people in Europe, and they're all covered by single-payer health insurance.
Doctors GSAs now? Are you gonna go ahead and do like Hillary Care, where Hillary Care had a provision if it had passed in the 90s, where if a doctor gave services to somebody outside of the scope
Julio,
of
we're hitting the wall here. I'm sorry. Julio Rivera, Editorial Director of Reactionary Times. Hang on just a second. Oh, you can tweet him at, oh yeah, it's Julio. Thank you, Julio.
Thank you, Tom.
We'll be back.